Healthcare continues to be a top concern for Canadians right across the country. And on Second Street, we're always keen to hear about health reform options that are actually making a difference. And so today I'm pleased to sit down and talk with health reform with Alberta's Premier, Danielle Smith. Premier, thank you for taking a few minutes to chat with us about this important topic that affects Canadians from coast to coast. I'm wondering if you could start off by telling us, I know that under the previous Premier Kenny, and under your leadership, we've seen some health reform measures going forward. Are there any in particular where you can see positive changes happening right now that maybe other provinces may want to take note of?
Well, so many, and I can maybe start with the very first innovation, which was charter surgical centers. A lot of these are doctor run. And so what we've done is that we've created contracts with these independent surgical providers. So for a certain number of surgeries, and that has allowed them to take that guarantee of a certain number, a certain amount of income, go to the bank, and then they're able to finance the construction of their own surgical center. And I can tell you, in the case of one in particular, which does knee and hip replacements, we fund them about 4,500 surgeries. They were able to build a $25 million facility, and they have the ability to expand out. Now, if you compare that with what you would normally pay for a hospital, hospitals now are growing up to, $1-2 billion a year. It's a really cost-effective way of getting that precise, specialized care and do it rapidly without having to shoulder a bunch of additional capital costs. So that's one of the innovations I think others should follow.
And so just to clarify, if I'm a patient in Alberta and I need, say, a knee operation, I go into one of these clinics, I flash my Alberta health card, I get the surgery done, and when I leave, I'm not paying a bill. Is that correct?
Completely. I mean, the left always like to try to confuse the matter. They want publicly funded, publicly delivered service. We want publicly funded, competitively delivered service. And that could be charter surgical centers, it could be Covenant Health, it could be AHS, it could be some other service provider. As long as people aren't paying out of pocket, I don't think they care where they get their surgery.
So I want to talk about that notion of paying out of pocket, because obviously there are still patients in Alberta who are not getting care in a timely manner. One story, we had the gentleman on the show here, he was from Edmonton, healthy all his life, but unfortunately ran into back problems. He was facing, I think it was a 1 to 2 year wait in the system, chronic pain, described having some very dark thoughts as he was coping with this. He got to the point where he looked at paying for private surgery all across Canada. The only clinic that offered the type of surgery he needed was in Calgary. And he thought, oh, this is perfect. I can drive down the road to Calgary. Called the clinic, had a good conversation until they said, wait a second, you live in Alberta? We're not allowed to treat you. So strangely enough, someone from BC is allowed to come to the clinic and pay, someone from Saskatchewan and so forth, but he was blocked because of government rules. He ended up going to Atlanta and spending a small fortune to go down there. Is that something at all that you've considered changing, to take those restrictions off so that patients would have that choice that they have between using the public system or private options?
No, because here's the deal that we have with the federal government is that if they are going to fund our system at the level that they are, and it's several billions of dollars, then they require that no Albertan pays out of pocket for medically necessary care. So I'm looking at it a little bit differently. What I would like for us to aspire to is for us to make sure that we are clearing that backlog so that every single Alberta patient is getting their care within a medically recommended period of time. We've made some progress on that. When I first started, there were about 39,000 patients that were outside that boundary. We're now at about 27,000 patients, so we're slowly whittling it down, but we've got to aspire that no one waits longer than medically recommended. We've got to increase capacity in our hospitals, and in doing so, what I would hope is that British Columbia and Saskatchewan and Ontario, rather than sending patients south of the border to get the care they need, that they might decide to send them to Alberta hospitals because we're so high performing. So that's the challenge I've put to our Alberta Health Services and all of the players in our system. And I think I'd like to play that out a little bit more. And I can talk a bit about some of the changes that we're making to try to realize that, because we've had already some early successes.
Premier, when we come back, I want to talk with you about an interesting idea that you've talked about in the past. We've polled on it, Canadians love it. It's the idea of being able to go abroad and hand in your bills and basically get reimbursed by the government for those procedures when the care isn't provided in a timely manner. We'll be back in just a moment to chat more about this.